Okay, neck pain is a very common thing in the coat hanger and adrenaline neck muscle tightness. The adrenaline actually will cause people to lock their neck up. Another factor also that's very common is all our desk work and mobilization, that our necks will actually lean forward, will cause anterior front part of the neck to get very weak, which will cause over contraction of our traps and lats, cause us to push forward. We call it turtle, tech neck, secretary's neck, nerd neck, all these terms. Basically what happens is the front part of the neck muscles get weaker, these get tighter, our pec muscles will get tighter to compensate for the weak anterior neck muscles. And then what happens, all these muscles here in the back of the mid-back between the shoulder blades get weaker. All this sort of cross dynamics, they often call it cross neck syndrome or upper cross syndrome. So there's a lot of factors called the coat hanger because the blood can't get vertically up. There's a lot of neck pain in that regards. Often people notice it. Worse neck pain when they lay down. They get better, they sit up, they feel worse. Adrenaline neck pain, due to the adrenaline will cause instinctive muscle locking and all the consequences of desk work and mobilization will cause this sort of upper cross neck syndrome. So there's things that you can do to help your neck. First is identify what is the cause and mechanisms, provide there's no structural problems to your neck, doing ongoing mobilization. Many people cannot move their necks this degree of plane. Your neck has forward extension, forward flexion extension, sideways, and then rotation. Many of you can only do limited motions. So the key is you really want to practice in a day flexion, extension, rotation, rotation, sideways, 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 back, back, rotating all around, all these directions. Do as many times a day as you can. Do what you can. If you can only do, what do you call about 20 degrees, 10 degrees, 10 degrees, 10 degrees, that's what you can do at this point. The more you do it, the more you can do it. Also, many people with adrenaline locking, the shoulders start coming up, the head pushes forward. You want to really learn to relax the shoulders. And a lot of times you have to do is just drop the shoulders down the best you can. You might notice you don't even do that. Just do it. And a lot of times you have to either just learn to breathe out and push head back. And it feels not natural to do that. But often in the day is repetitive movements and stop and pause to try to do this. If you're hypermobile, it can be difficult to do this, so be careful. Okay, we're going to do an exercise that's very simple to do, but again, be careful if you're hypermobile and you're going to do it that feels not overstretching. Don't be overzealous. It's going to loosen up the scalene, which is this muscle here. It gets very tight with nausea, tightness, headaches, neck pain, coat hanger, adrenaline, and the trapezius and levator scapula. We're going to work on this. Put your left hand down, straight. Get your right hand. You're going to take your right hand and put it behind you, and grab your left elbow, and then turn your head to the right, and just turn. You're going to feel sort of a tug stretch in your right trapezius neck area, and just breathe slowly in and out through your mouth for 5 seconds to 10 seconds, and then let go. Now you're going to do the same thing on the other side. Get your left hand, bring it behind you, grab your right elbow, and then turn your head to the side, and then you're going to feel a little tug stretch. Don't go overzealous. Breathe slowly in and out of your mouth for 5 to 10 seconds, and then let go. Key point is don't overdo it. If you're hypermobile, be careful. Make sure there's no underlying structural issues. And do this a few times in a day. This will help you.